Hello, my name is Ingrid Pretzer, Aboff. I'm a neuroscience researcher. I'm a professor in the School of Nursing over here at PCO. Nursing practice is based on evidence. So nursing research is creating that evidence that's not there, maybe identifying gaps and moving research forward, which will lead practice forward. I've worked with Parkinson's patients for many decades and in clinical practice, and in my observations is patients get a diagnosis and they go home with it. Many people don't know what to do. I focus mostly on function, is an interest of mine in keeping people as independent as possible. I work with an older population, adults, and an older population with specific neurodegenerative diseases such as Parkinson's disease. And I develop and test interventions that help them do just that, stay independent by improving activity and keeping them functioning. And I'm focusing mostly on non-medical treatment and non-surgical treatment that everybody can do. So I test interventions, develop them and test interventions. And when I say the word I, it's myself and my team. It's never just myself. I don't have all the pieces that I need to create something that's effective. So I work with a lot of different people across campus and even across the state and out of state. So I quickly realized in the first probably 5 years working with them is I need a device that will measure their function objectively. So we developed a device to put on the feet that look at gait or walking patterns of a person with Parkinson's. That's super important because then I flipped it over. Well, if I could do that, why can't I see their gait and then institute an intervention? So working with various people, even in India, we tested it and we came up with some really good results. So now we bring it to the United States. You tell an engineer that vibration might help a person with Parkinson's disease, and they build you a shoe that has vibration in it. So I have worked with that since probably 2013, but over the years we've looked at vibration, and I look at it and I see people wearing the shoe and I go, we're measuring their gait, we're looking at the vibration. Why can't I predict vibration? If I could see it, I'm sure we could develop a machine learning system that will do that, and lo and behold, we did. We're coming up with products of how could we help patients walk better with a specific freezing of gait issue. Finding this was a big hurrah, yay, let's see. But it didn't help every single person, so why? So we get together and I'm thinking, maybe we don't have the right dose for everybody. Maybe this needs to be individualized. So maybe the hertz, the vibration frequency, or the vibration, the way it heads down on the patient, the amplitude of vibration is the issue. And maybe how long you wear the vibration will matter. So we're calling that the dosage of vibration. And we're testing that dose of vibration in 3 different ways. We're testing it on a set of patients to see how they do in settings where we could trigger freezing of gait. And we're looking at the dose of vibration in the lab, which means a straight hallway and people walk up and down. We put obstacles in there to trigger freeze of gait, but it's still clinical and it's still very controlled. And so we're able to detect it with this algorithm, which is wonderful. And then we could start now attaching that to future data, figuring out when that person's just freezing in a nanosecond, and implement a strategy. It could be the vibration or another strategy. But that closed loop system is really pretty powerful. So we're right at the cusp of that. Our future thought is to predict it before it happens.